So, what exactly is clinical psychology and what does it focus on?
in different settings, especially in colleges, universities.
So, what is clinical hypnotherapy and how is it different from clinical psychology?
So there is one word called hypnosis, the other word called therapy. So it's a
Welcome, viewers, to No Hurt Mentality, a podcast that deep dives into careers to give you great insights through conversations with people who have been there and done that. Today, my guest is Dr. Jini Gopinath. He's a well qualified clinical psychologist and a trained clinical hypnotherapist with expertise in psychological assessment, psychotherapy techniques, corporate employee wellness, and performance coaching. He pursued clinical psychology from Kasturba Medical College, Manipal, and is also a PhD in psychology from University of Kerala. He has an enriching experience of over 20 years working in different fields related to mental health, wellness, and education. Thank you so much for being with us today and taking out your valuable time.
thank you for the invitation. Thank you.
So, Doctor, I have realized through my own personal experiences that psychological well being or the mental well being is a lifelong journey. And it is never too late to seek for help, learn the tools that you need to build a resilient mindset, rewire your brain, and make positive changes in your life. Now, you are a very well qualified clinical psychologist. So, what exactly is clinical psychology and what does it focus on?
Okay. Oh, that's a very valid point at this point in time because there are a lot of debates going on about the need for mental health. Uh, there's a huge discussional debates about corporate mental health, people committing suicide in different settings, especially in colleges, universities, and even in corporate organizations. When we look from outside, these are all very successful people. And why is it happening? What could be the reason for that? There's a lot of debate. So, clinical psychology is a branch of psychology which deals with the application of psychological principles in clinical population. So when I say clinical population, people suffering from mental health issues. It can be as simple. When I say, don't think that I'm minimizing the impact of a disorder. The term that we are using on a regular day, like commonly on a regular day, like stress, starting from that to an intense or kind of a chronic psychological condition like schizophrenia or psychotic, like schizophrenia, other psychotic disorders. Um, and even if you look at psychiatry, that's a different specialty altogether that we will discuss a little later. But clinical psychology focus on non-pharmaco therapeutic models like psychotherapeutic processes, counseling, psychotherapeutic practices. There are different psychotherapeutic models available. So, depending on the training attained uh, by that particular clinical psychologist, they will employ psychotherapeutic processes to help the client in terms of empowering the client coming out of the disorder and to prevent this disorder in the future. So clinical psychology is a branch of psychology, deals with clinical population.
And you are also a very well trained clinical hypnotherapist. So, what is clinical hypnotherapy and how is it different from clinical psychology?
Okay. So hypnotherapy is a therapeutic school, a therapeutic model which comes under clinical psychology. So when I don't want to limit it to clinical psychology alone, I would say that hypnotherapy is a so therapy, hypnotherapy. So there is one word called hypnosis, the other word called therapy. So it's a treatment using hypnosis as a modality in simple terms. So it's not a part of clinical psychology. It's a part of mental health, and it's a part of um, what how do I say that? Anybody trained in mental health practices, the mental health professionals can engage in clinical hypnosis. So if you look at the Western model, psychiatrists, clinical psychologists, psychiatric social workers, even psychiatric nurses practice clinical hypnosis. So hypnosis, when you limit the scope to clinical practice alone, that is called clinical hypnosis. But the model can be used in other domains also, like sports, forensic side, marketing. It can also be used in the context of corporate mental health. So if you are focusing more on the clinical side, the therapeutic side, the counseling side, it becomes clinical hypnosis.
But is psychology a prerequisite for getting trained in clinical
Uh,
hypnotherapy?
yes, that's the reason why if you the moment you say that it's a clinical hypnosis, then you might require a clinical background to practice that.
All right. Now, if a student is aspiring to pursue a career in psychology, what are some of the potential career paths that he can follow, starting from the subjects that he needs to take in 11th and 12th, and the kind of degree programs which are available at the undergrad level as well as the postgrad level?
Okay. So now, if you look at the graduate schools in India, the bachelor's programs, the eligibility for getting into the program do not always require a psychology background in the plus one plus two level. So plus one plus two level, if you are able to take any course, some of the universities do not have any problem in taking students from humanities background or from commerce background also. Some universities, especially teaching clinical psychology program, because they have a lot of these biological psychology and other statistics and those science related courses, they prefer students from science background from the 11th and 12th. And once you get into this course, we have a lot of courses like uh, bachelor's in psychology, bachelor's in clinical psychology, run by clinical psychology deaneries, or we also have liberal arts in some of the universities where psychology is not taught from a clinical angle but taught from a different perspectives, the cultural psychology part of that and things like that. So once you complete your bachelor's in psychology, now there's a 3-year bachelor's and a 4-year honors by the new educational policy. Once you complete that, you are eligible for the master's training. And master's training, either you can do a direct master's in clinical psychology program. By the way, this structure can change because University Grants Commission and Rehabilitation Council of India (RCI) is redesigning the entire clinical psychology courses. So once you complete your masters in psychology, then you can think of remember masters in psychology itself can be treated as an end specialty program. People can get into teaching, they can get into research, they can get into counseling, psychotherapy, in Indian setting. It's these are all possible. But remember, masters in training in India is not a specialized program. That means to say that they are bombarded with a lot of courses, and to start practicing, they might require separate specialized certification courses, right? So, for example, if you want to become a clinical psychologist, you are expected to complete a 2-year uh, MPhil in clinical psychology to become a clinical psychologist in India. And there are courses like uh, MPhil in rehabilitation psychology after this master's program. Hmm. These are all for clinical and rehabilitation, but there are a lot of other branches like
Yeah, in fact, that brings me to my next question. If you can elaborate on some of the major sub branches under psychology, apart from clinical psychology.
some of the popular branches in India. There are school psychology courses where people, specialists working with the school psychology system, the mental health of students, teachers, and all. There's education psychology where not only they work in the mental health of school system, but they are also into pedagogy. modifying, preparing systems in place. And we have now the new trends like military psychology, where there are a lot of psychologists getting employed at DRDO, Defense Research Development Organization, private organizations to work on developing tools to help the military professionals to be more
Very
focused
nice.
and focusing on their mental health. Forensic psychology, where they work on the forensic side,
Okay.
which there are in India. We have a forensic university, by the way, in Gujarat, Gujarat Forensic University, where they have courses exclusively on forensic psychology. We have sports psychology, by the way, mental health of sports, where the performance coaching, all those things comes under that. So we have aviation psychology, where after the lot of these issues with the pilots struggling with mental health issues, and there are a lot of accidents or issues happened in the flying arena. So that became popular after that. And by the way, there are lot many. Some of these things are very commonly seen outside. Career psychologists, organizational psychologists, where people working in the organizational setting. Slightly different from that of MBAs working. HR, human resource development in the management segment is slightly different from that of the uh, organizational behavioral. They have a branch. They have papers taught in MBA also, but this is exclusively working on the
Okay.
organizational systems. Mental health is one area, but otherwise it's about productivity and reducing attrition, increasing resilience, and things like that.
Mm. That's wonderful.
These are all very. And it is not the comprehensive list, by the way. You need to
Yeah.
see that there are lot many more outside.
So when do you choose which specialization, or in which branch do you want to specialize in? Like you mentioned, so many sub branches under psychology. So at what stage do you decide that this is where I want to branch out to now and specialize in this particular field?
Okay. So I strongly recommend kids to wait till completing their graduation, and if they are able to intern some of these organizations, some of these specialities, and see that whether they're able to connect with it. So I've seen that a lot of people taking up psychology, clinical psychology, and when they are posted in clinical psychology settings, mental health centers and other organizations, they feel it too much for them to handle, and they withdraw and join another program. So I always recommend kids, if they are kind of ready to get into psychology post graduation, before you specialize, you might need to get into internships and understand, meet people. Not like before. When I was a student, we never had these kind of opportunities. But now, in online itself, you have a lot of these internship opportunities available. Uh, Otherwise, you get into a generic master's program and then decide on specializing after your master's. So those options are also available.
I think that's a great advice, explore through internship, through mentorship, through volunteering before deciding on what works for you and what suits you in the long run.
Exactly. But I have also seen that people getting into clinical psychology uh, work there for 5 6 years, then taking a break and exploring other opportunities. That's also fine. So I worked in university settings, then moved into full time hospital settings, then into sports psychology, then in corporate mental health right now. So you can always explore different opportunities, options, and if you're excited about it, you can continue.
Correct, correct. Now, you are also a PhD in psychology. So, what are some of the advantages or the edge a psychologist will have who is a doctorate in psychology?
Yeah. So one of the primary reason why I took PhD in psychology is that because I was interested in teaching and I wanted to get into university teaching. So that was the reason why I took up PhD in psychology. But otherwise, also a PhD in psychology is actually considered to be um, the culmination of your educational journey, right? If you are serious about it, your training, your career, then I strongly recommend uh, people who are also tuned towards research. get into PhD. But otherwise, PhD doesn't make any sense for a clinical psychologist if they're not interested in research. But now in India, we have a PsyD, not just PhD alone. We have PsyD, where that is basically a practitioner doctorate. You
Okay.
practice in a mental health center or a or a uh, training institute and
Hmm.
see clients and uh, complete your doctorate. So
That's interesting.
two ways in which you can get into a doctorate. One is
Mm-hmm.
PhD, the conventional model,
Mm-hmm.
research. The other one is PsyD, it's a practitioner model. So if you're a
Oh.
clinical psychologist, then I recommend
Mm-hmm.
PsyD. But if you want to get into research and teaching
Mm-hmm.
in the long run, then PhD is better.
Oh, that's wonderful. That's a very great insight. So, what is a job profile like of a clinical psychologist, and what is an earning potential like for the qualified clinical psychologist in India?
Okay, so clinical psychologist, when can you call yourself a clinical psychologist? As per the Indian system right now, masters in clinical psychology alone may not be enough. You might need to do an MPhil in clinical psychology.
Okay.
MPhil at this point is a 2 year training program post your master's training,
Hmm.
and that you need to complete it from an RCI recognized university.
Okay.
Because once you complete that, you will get a registration number from RCI. So that is required for you to start practicing as a clinical psychologist or call yourself as a clinical psychologist. So the designation is clinical psychologist, consultant clinical psychologist in a hospital setting or in a research institute or where you are expected to see clients, right? Depending on the nature of work you do, the kind of hospital chain that you work for, is it a government institute, a central government institute, a private institute, or a corporate engagement, your salary can change. But usually in India at this point, for a clinical psychologist, salary can be around, the starting salary can be around 50 to 50,000 per month to 1.5 per month.
That's nice. I mean, that's a good start for a clinical psychologist's job.
But if you look at it, 90% of the people work for 50 or 55, 50 to 70,000 per month, primarily because they may not be able to find that suitable fit. Not many organizations can provide you with that one or
Hmm.
1.5 lakhs per month for a beginner, for a fresher.
Yeah, right. And how does one obtain a license to become a licensed practitioner in clinical
But by
psychology?
the way, in India, there's nothing like a license; it's a
Okay.
registration. Like
Okay.
I said,
RCI that you mentioned about. Okay.
that means to say that if you have completed your master MPhil in clinical psychology,
Mm-hmm.
or that way MPhil in rehabilitation psychology also,
Mm-hmm.
and you've done it from an institute which is recognized by RCI, and you can apply directly to the um, institute, I mean RCI council, and they will issue the registration number. So that number needs to be displayed when you practice. The number needs to be written in your communication with your patients or in the certificates or in the reports that you provide. And that is valid for 5 years, and you need to renew it every 5 years.
Okay. So, what are some of the essential skills you would say is needed to become an effective psychologist?
Okay, very good. So this is a very good question, by the way. It's a difficult question also. Um, See, primarily the psychologists, clinical psychologists work um, in a mental health setting where you may not have uh, a biological testing procedure to understand the psychological system of an individual. You cannot send them for an MRI,
Correct.
blood test, or something like that. You will get structural changes in the brain and things like that. But ultimately, it's a very subjective world that you need to explore. So there are a lot of counseling skills that you might require to get to know more about the client. So it's about questioning skills, building proper rapport with the individual so that he will start trusting you, because he's going to discuss very delicate things with you, right? And he has not told these things outside
Yeah.
with anyone, including his close friends. So you need to develop that kind of a relationship process. He needs to see that there's a non-judgmental space. So the kind of effort that you need to put in terms of developing that, like the attending skill, questioning skills, a non-judgmental space, basically completely empathetic in the process, being there with the client, helping the client understand that this person is genuinely interested in me. So these are things which uh, you you are trained during your training, and also you might need to practice it in such a way that over a period you will be able to polish your skills. Uh, so these are some of the things which are required for you to sustain, and to have proper clinical knowledge about understanding the problem of this individual and designing a suitable therapeutic model for the person.
And how lucrative and worthwhile it is to pursue your psychology degrees from abroad versus India. Because the kind of, yeah, you can take your time because,
No, because of sound from the plane. That's
okay,
right.
because
So,
the kind of expense that you incur to send a child to study psychology from abroad is far exponentially higher than what you would spend in India. So, does it make any sense to send children to study psychology abroad, or is India pretty self-sufficient and good in their programs out here?
I have a different take on that, because psychology, if you look at it, psychology is, when you look at a client, you're not looking at his psychological system alone. There are a lot of cultural, social, political, economical factors play a role here. So you're going to the Europe, where the socio-political, economical space is completely different, and learning psychology there and trying to implement the same learning
Mm,
in a country like India may not be a suitable fit, first of all. Right, but
correct.
definitely you can look at training, because learning is always good, and you have very good universities in the West. But transitioning into India might be a challenge for you. First of all, you might take some more time to unlearn some of the things that you learned there to practice here. Previously, people went abroad to study there, and they stayed there and they wanted to continue there. That's a different side, right? Because for them, the question of coming back and how lucrative it is doesn't make
Mm,
sense. But
mm,
of late, what happened was the visa systems are slightly becoming
mm.
different in the West.
Difficult. Mm,
So even in UK, if you look at it, most of the people used to go to UK because it was
mm,
1 year masters there.
mm.
But we found that people are not able to extend their visa.
Correct.
When they come back, the kind of, it's like a return of investment, right? Now you invest
Mm,
50 lakhs for training, and you come back and you get around 25,000 or 30,000 per month. Doesn't make any sense,
correct.
right? So if I have to answer that in one word, I would say that it's is it lucrative? It's no, unless and until you stay there for some time, work for some time, and then come back.
All right. Now, we have seen that common man like me often get confused between a psychiatrist and a clinical psychologist. So, what is the difference between the two, and how does a common man or an individual decide who is the right specialist to approach?
Okay. So psychiatrist is a medical professional. He has done his MBBS, the bachelor's in medicine, and also his specialty in psychiatry. So there are two courses. One is diploma in psychiatry, DPM, or otherwise MD. Right. Both of them are equally qualified in practicing psychiatry in India. Right. Their primary treatment methodology is pharmacotherapy, prescribing medicines. But they are also trained in psychiatry, I mean, psychotherapeutic methodologies. But in India, since the number of psychiatrists are very less, most of them do not have much bandwidth to do psychotherapy. Right. But who is a clinical psychologist? Clinical psychologist is not from a BBS background, but they have done their master's in psychology and a super specialty training in clinical psychology from a clinical training institute approved by RCI, and they become clinical psychologists. They are primarily into counseling and psychotherapy using different psychotherapeutic models. So some clients may not require medicines.
Mm,
Some clients require combined treatments. Say,
mm,
for example, if I look at depression,
mm,
mild to moderate depression may not require a psychiatric support. If you look at it, they can be cleared, they can be helped by using therapeutic models like cognitive behavioral therapy, where a clinical psychologist will provide. But remember, when the case is becoming chronic, the impairments are slightly on the higher side, intense suicidal ideations, then definitely they might require a psychiatry support. But otherwise, also, if you go to a psychiatrist or a clinical psychologist for consultation, the ethically driven professional will always help you to find the right professional. Say, for example, if you go to a psychiatrist for consultation and he thinks that you don't require, your problem do not require medication at that point in time, they will definitely recommend you to a clinical psychologist. The same way with the clinical psychologist. Right.
But to add to the confusion, nowadays we have counselors, life coaches, therapists, apart from clinical psychologists, and these terms are often used interchangeably.
Yeah.
So, for an individual, it becomes very confusing who is the right professional to approach when they are grappling with mental health conditions.
Okay. So what happens is that clinical psychologists, so counselors, we have a program called Masters in Counseling Psychology. That's also an end specialty program. They are also trained in counseling protocols, right? So they are counselors. They are qualified if they have a master's in psychology from a reputed, recognized organization. Therapists, clinical psychologists, these counseling psychologists sometimes use this word interchangeably. But in India, unfortunately, there are a lot of these therapy programs which are taught left, right, and center. But remember, uh, to practice therapy in India, you might require a master's in psychology at this point. It can change later. So always remember when you go for support, taking support, always look for the qualification of that particular person. That is the best way to avoid confusion. Life coaching, there are by the way, clinical PhD in psychology, or there are no courses in life coaching from the university levels right now. They have been discussed and debated in some of the courses in MBAs or psychology and all. But the people who claim they are coaches primarily become, I mean, from they're getting trained from some Western councils, right? Um, but those people are not they're not dealing any mental health issues. That's what I understand. If they are dealing with mental health issues, then it's wrong. It's unethical. It's unethical. So if you are empowering somebody who is a normal individual in terms of becoming a better version of themselves, that's absolutely fine. But the moment those untrained professionals get into counseling and psychotherapy, then it's unethical. That is not appreciable.
All right. Um, you have also worked as a performance coach, yeah? And you have worked as a performance coach for some of the well renowned IPL teams like Mumbai Indians, Kings 11 Punjab. So, what is a role of a performance coach?
Okay. So in these organizations, I was not directly employed by them. I was a third party assignment provided to them. The ultimate agenda of performance coaching is to improve their identify what are the blocks in terms of stopping them to go to the next level. It can be anxiety, it can be worry, it can be tension, or it can be anything. Say if one of the very famous sports professional who has written this book called um, you know I forgot the name of the book, but Tim Galway is the name of the author. Timothy Galway. Tim Galway. So that particular professional used to say that when a professional goes out for playing, they are playing in two fields at the same time, one out there and one between the ears. That means Inner Game of Tennis is the title of the book, by the way.
Okay.
He has written one more book called Inner Game of Golf. So they very clearly say that if you're not able to synchronize what's happening here and what's happening outside, then you can't become a good sports professional. So how do you sync it? That is what the role of a performance coach.
Very interesting. And what is the selection process like, to be hired as a performance coach by these IPL teams for their players? Like, what are they looking for?
And there's no coaching, there's no course like that. By the way, because we've been working in this domain for a long time, so that's the reason why uh, they've asked us to support them. In my team, it's not about performance coaches alone. We had people from all of them are from psychology background, but some of them are from management background also, working with teams, uh, building teams, maintaining networks, and those kind of stuff. So, um, performance coaching from a course perspective, from a profession perspective, there are courses abroad, but predominantly we used two models from our training. One is cognitive behavioral model and hypnosis. These are the two models that we used in implementing this particular model, particular process.
So, is performance coaching same as sports psychology?
Sports psychology is a larger umbrella. In that performance coaching is one just component.
Okay. So, if you are a qualified sports psychologist, then you can also take care of performance coaching.
Definitely.
Okay. Now, mental health conditions and ailments are still a big taboo to talk about openly and freely. In fact, if families don't even acknowledge if there is a member who is grappling with mental health condition, which results in either a delayed or a denied diagnosis or a treatment. Do you see this belief system changing now, both in India and worldwide?
Yeah. So India, the scene is different because of the stigma, the discrimination. We have difficulty in talking about mental health openly, mental health issues openly. But things are slightly changing because a lot of people coming up openly talking about it in social media and all about their mental health issues. So it's giving motivation. So I would say that we have long way to go, but from a society perspective, it's time for us to start openly talking about it. And also, as from a podcast perspective itself, people like you should focus on building awareness about mental health, and so that people know that this is like the way physical health, mental health is also another issue that can come up for a normal human being. It can be treated, it can be managed, it can be modified. How, as a society, we can look into that so that we can help each and every one, so that uh, the asking for help is your right can be promoted.
So, what are some of the collective steps that we can take so that mental health is a much easier topic to broach? Because the need of an hour definitely is to tackle it and not to taboo it.
Yeah, I would say that let us start from our families itself. Let us openly talk about it. About, say, for example, if I see that I'm stressed and anxious and worried, what is stopping me in terms of talking about it in my family? One thing people say that if I say what they will think about me because they think that I'm weak, or if I say that will they be able to receive it the way I wanted. That I would say that that's a start. That should be the starting point. There should be awareness campaigns everywhere. They need to understand that these are all things that can happen and can be prevented also. If you look at the statistics now, around 18 to 24% of the Indian population struggling and suffering from emotional issues. How many in that percent? How many people are able to identify that they have a real problem? And the people who have identified, how many people are able to go to a mental health professional? There can be a lot of reasons where they're not able to find a right match, financial difficulties, things like that. We can discuss about it later, but at least we need to start from the basics, building awareness.
Yeah, I mean, it is the common perception is that the person who is struggling with mental health ailments is someone who is extremely negative in life, has no gratitude, does not appreciate, is taking things for granted, you know. So you are kind of very afraid of projecting that kind of a uh, personality about yourself to others.
That's what I'm saying. So these misconceptions needs to be eradicated. This can be done only by educating the public, and that we need to go in large scale. Um, the best way to start from home so that
Mm.
all of us can go out and talk about it openly in our extended families, networks. So let it be a common topic of discussion.
There's a lot of fear of being judged.
That can be removed only by we started talking about it, right?
Hmm. Right.
Yeah. So
I think
education
one,
is first, we're still stuck there. Education is the first level, and we are still stuck there. We need to go beyond that after some time.
yeah, I think it should, in the times to come, it should become as easy to talk about mental health as it has become easy to talk about cancer or heart ailments or, thyroid or etc. I mean, cancer patients are now called warriors once they kind of fight it out and defeat cancer. I think same holds true for mental health. They should be the ones who are able to overcome and go on the other side. Should be considered absolutely warriors, and that's the kind of a perception we need to propagate, rather than shaming them.
Yeah,
Or yeah,
yeah, you said it. Yeah.
yeah. So, what exactly is the role of a chief psychology officer?
Okay. So I'll just tell about what the kind of work we do, and then we'll get into the definition of this particular role. So it's a mental health startup. So we work with in a B2B space predominantly. We work with organizations, education institutions, all IITs, IIMs, corporate organizations. We handle their mental health issues, starting from awareness campaigns, webinars, workshops, training programs, and taking online sessions, chat, offline engagement, audio, video sessions. So the psychology team designs the programs, recruit the specialists for those engagements, monitor it, supervise it. So end-to-end protocol development, program development. So the psychology officer oversees it.
Oh, this sounds wonderful. Such a great initiative to reach out to as many people as one can. Because, like you said, your organization ties up with some prestigious institutes like IIT, IIMs in India, where, nobody would actually imagine that students in such prestigious institutes can also grapple with these mental health
Yeah,
issues so much.
unfortunately, that's the reality.
Yeah, that's great. You are doing some great work, doctor.
Thank you.
And we wish you all the best in your future endeavors. We definitely need more such organizations and initiatives that make mental health a very easy topic to talk about and have more awareness programs, workshops, to make it a common parlance, or to make it like a topic uh, of a household, like a common topic to talk about in any household, rather than speaking about it always in those hushed tones and in
Yeah,
whispers.
that's the agenda.
Great. Thank you
Okay.
so much, Doctor, once again, for taking out your valuable time. We greatly appreciate your time and expertise.
Thank you, Ruchika, for the invitation. It was great.
You were listening to No Herd Mentality Conversations. Please stay tuned for more such in depth conversations. I am Ruchika signing off on behalf of No Herd Mentality. Yeah.
Bye.
Bye. Thank you. Bye bye. Thank you so much, Doctor, for taking out the time to give us these great insights. I'm sure it will help both parents and students understand a bit better about psychology, clinical psychology, and make some informed choices, make some, you know, correct decisions towards their career.
Thank you. Thank you for this initiative, Ruchika, and looking forward for more such interactions in the future.